used the auto, so the EPAP also changed as the pressure support changed. But the difference between the two devices, when it comes to the two main companies that manufacture these things, is that one monitors minute ventilation and the other one monitors peak flow. It's not always one is better than the other, it's just how they are designed. So one will always be more sensitive to how fast they take a breath and how much. The other one is on peak flow. I can tell you more about one company because I used to work for them, but I don't want to do that. They're not paying me to do this. Okay, the point here is that there are differences when it comes to the algorithms, but ASV, the great thing about ASV is that you can use either the dynamic backup rate or you can set the backup rate yourself, right? It's up to your protocol whether your medical director will ask you to titrate with the backup rate or just utilize the device algorithm, the automated algorithm. Now, the key with ASV titration has always been to look at it from a close-in look, where you're looking at your epoch at 30 seconds, right? And after you increase pressure or you make any changes, you always will have to wait minimum 10, 20, 30, 40, 50 minutes.